If you ever wondered whether IV nutrient therapy is truly worth it, who it helps, who it doesn't, how it works, what to expect afterward, and why it's offered in both hospitals and private clinics, this video will give you the full evidence-based breakdown. By the end, you'll know exactly whether IV therapy is right for your body or not. In today's video, I'm breaking down IV nutrient therapy in a clear, science-based way, without the hype, without the fear, and without the confusion. We'll cover how IV therapy works, who would benefit most, who should avoid it, and what the research says, the difference between hospital-grade and wellness clinic IVs, what you should expect during and after the infusion, potential side effects, and how to tell if your body actually needs this level of support. I'll also show you real examples of nutrients being added to the IV bags so you can see exactly what goes into them and why. Hi, I'm Dr. Evelyn Le Ellis, a naturopathic and integrative physician, and I help women understand what their bodies are actually trying to tell them so they can make confident, informed decisions about their health. I also run a clinical IV therapy program where we use targeted nutrients to support recovery, energy, immune support, health, and stress resilience, and only when it's appropriate. So today, I want to explain IV therapy in a way that finally makes sense. So let's talk about what IV nutrient therapy actually is. IV therapy simply means delivering nutrients directly into the bloodstream, bypassing digestion. Why does that matter? Right? The question. Because when you swallow supplements, medications, or food, your gut has to break it down, absorb it, or transport it. But if you are inflamed, stressed, or dealing with absorption issues, your gut may not be doing that efficiently, especially for cancer treatment or anyone who have any IBS or any IBD, irritable bowel syndrome, or irritable bowel disease. IV therapy allows nutrients to go straight into circulation, giving you faster absorption, higher concentration, immediate availability to tissues, zero reliance on the digestive tract. This is why hospitals use IVs not for wellness, but because absorption needs to be instant. For any one of you out there cannot absorb the nutrient into your body, how do you know that? Especially when you have a problem with digestion, feeling bloating, or even feeling as if the food doesn't go through, feeling a little bit more cramping, or loose stool, or even constipation, alternation of irritable bowel syndrome, I highly recommend to get it worked up with any holistic practitioner. The alternative way, instead of eating, because if we don't know if our gut worked the most, what I often do is the IV therapy. So I have like a bunch of these things come together from the fridge and put them in the bag and do the IV line come into the vein and get it in. So in the traditional allopathic medicine, they do a lot of sodium chloride, or sometimes they add on of any type of magnesium or any type of potassium, etc., but very limited in the hospital setting. In the holistic realm, we often will add on a lot of nutrients. So let's watch for the next video to see which one is that. So let's talk about why some people want or need IV therapy. There are 4 main reasons people benefit from IV therapy. Low absorption or gut issues is number 1. If your gut is impaired, you may not be absorbing nutrient enough from food or supplements. Common examples is chronic stress, IBS, irritable bowel syndrome, or SIBO, small intestinal bacterial growth, gastritis, bariatric surgery recovery. And second reason is a chronic fatigue or high stress demand. Your mitochondria, your energy factories, require B vitamins, magnesium, and antioxidants. If you're depleted, IV therapy can give you a meaningful boost. And I see it in real life. The third reason is immune recovery. Vitamin C, zinc, glutathione, these support immune balance and recovery after illnesses or high inflammation. And this we can see after travel or hangover, right? Fourth reason is high performance or recovery support, such as athletes, executive, caregivers, or women in midlife who feel drained by life load. IV therapy does not replace a healthy lifestyle. Hear me on this. It can support your system during times when your demand outweighs your capacity. Let's talk about who is IV not for. And just as important, IV therapy isn't for everyone. People with kidney or liver disease, not for them. You must be screened. These organs clear the nutrients and fluids. If they are overload, we don't want to even overload them. And second is people with uncontrolled heart failure. Extra fluid can increase the volume load and make your heart work extra. So we want to screen them out. Number 3, those with electrolyte abnormalities like sodium, potassium, magnesium must be considered. We have to screen to test for those to make sure everything is in normal range. Fourth, people are expecting IVs to fix everything. This is the first thing I'm just like, nope, it won't fix everything. IVs are supportive. They don't fix the root causes. 5, anyone with severe needle anxiety or vasovagal episodes, meaning you pass out when you have a needle in your arm. And this can be a barrier unless done really carefully. A responsible clinician screens each person carefully before infusing anything.
Who hear about glycine before? It is a very good information for supplement that they add on if you have a brain health that you need to support for brain concentration. And also people use this one in combination with B6 to make sure they can decrease any depression. And glycine is amazing for that capacity to support your brain health. I love this, especially before bedtime. It's very amazing too. I want to talk about MIC L-carnitine. It is a methionine, inositol, and also carnitine. And this is usually used for any weight loss. So if you hear about GLP-1 or any type of tirzepatide, semaglutide, Ozempic, Mounjaro, all of those around out there, they always have a side effect. So when people going through that, they need to have lymphatic drainage, way to really get fat out of the body or the adipose tissue with hydration, nutrition, etc. So these MIC carnitine or they add on with the B12, these are very helpful to help lymphatic drainage, to make that movement going out of the body and also the cleansing effect. I always throw this on if you are on any injectable and also any weight loss medication, just to make sure that your body receives enough nutrients, because side effect of those medications is to delay your gastric emptying. And if you don't eat enough, you don't have enough information in your body, then potentially you lose weight, and also long-term effect, you feel tired, you feel more hair loss, you feel more fatigue, etc. Now, biotin. So if you think about B7, vitamin B7, and people are looking for about hair, about nail, those are growing out. So biotin is so important as a cofactor, along with protein as a keratin, and also for the iron support for hair growth and a nail growth. So biotin is a very big majority in any of those supplements for hair, skin, and nail. You can also do IM or also IV infusion of this biotin in any combination support as well. So here it is, at least you know another way to get that into your body. Lysine. This one is so important. During the immune function, I always combine vitamin C, lysine, zinc, and any B12, vitamins together. Those are so helpful to kill because they are antimicrobial, antivirals. So when you have the big, like long haul COVID, any type of even shingle, cold sore, or feeling like consistently being sick, especially in the winter, when the winter is very cold, the opposite glove pretty warm. So these are helpful into that. And vitamin C high dose level can be used for cancer support as well, to make sure everything is antioxidant, but use away from any radiation or chemotherapy. And I use this one sometime if people cannot do IV, I do IM, and those are very helpful. L-carnitine, rarely anyone talk about this. To combine with the NAD and the methylcobalamin, I often also have the B6 and also B12 level. A lot of these, when you combine them together, it's gonna be called a formulation for mitochondria support. That we talked about the NAD nasal spray earlier or before. So these are the IM. When you do the NAD IV, go very slow. So if the provider go too fast, you will feel it and you can tell them, can you please slow down? But you can feel that kind of changing and transformation in your body quite significant. So I'm always advocate for this NAD, and L-carnitine is one of those amino acids that is very helpful to support with the mitochondria support, such as chronic fatigue, feeling super tired. Even though you don't feel that you need them, there are testing like a micronutrient to find out if you really have deficiency of any mitochondria. And I would say try and error. I always encourage my clients that your body is a temple. If you know what it needs, you know exactly what data that is, you do a try and error, do the experience for yourself, then you will exactly feel the empower and confidence. Let's talk about vitamin D. So this one is a D3 100,000 IU. Often that you hear about people taking tablet, chewable, or even a capsule of vitamin D, especially people who live in Northwest like I do right here, or very cold, not much of sunshine. And they also have the vitamin D injection. I always check vitamin D lab work for patients. Believe it or not, most of the time the first patient coming in, they thought they were having a good number, but eventually it comes like 10, 15 below normal level. And I advocate for you to ask other providers to check for yourself at least once a year, especially in the time when the weather is not that bright out there. Right now in my house, it's pretty bright out there. So this is a summertime where I don't use too much of the vitamin D. So for the injectable, you can do the injectable on your arm or your glute as an IM. It goes very, very strong and fast. So whenever I recommend that for clients, I always make sure they do maybe once a week or once every 2 weeks or once per month, and recheck the level at least 3 months or 1 month after using it to make sure you're not overdose, because too much vitamin D can also relate to the kidney stone or the calcification of the kidney or any body part of your body. So just to watch out for that. Glutathione is a big thing. If anyone who look into the beauty, the skin, liver detox, or any cleansing in your body, they always throw in the glutathione. This one is a little bit of IV or IM injection. When we say IM, mean intramuscular. That means we have in the syringe with a needle and we put them on the arm, both sides. I had another video about how to do the IM injection, or you put them on your glute as well. And this glutathione can also put on the IV line, which is intravenous. It goes faster. And when you do the IM, it bypasses the gut. Again, if anyone who have gut issue want to work faster, stay longer, then these IV are the best way to go straight to your bloodstream. But if you don't like that vein access, have a hard time with do the venipuncture, then the IM is the easiest other one to do. Just have a little like tinging sensation from that injection, but everything will be okay. Now, what is a good thing about glutathione? It's really helpful for any type of detoxification. In the liver, we talk about 3 different phases of a liver detox, not just 2, 3. So path 1 and path 2 always really required to have a glutathione to really move things through. When we eat food, we have medication, those are always required liver. So therefore we need to have a liver very strong and clear. Have anyone heard about NAD+? It coming in as a IV or True Niagen, have the one for oral. And this one is actually a nasal spray when you really go into your nose and you push them for 2 flush, 2 administration of 2 spray per nostril. So what does NAD do? It actually a nutrient, that backbone of your genetic or your DNA. It will come in to really help regenerate that DNA segment. And it is a lot of studies have shown about mitochondria support. If you hear about chronic fatigue syndrome or even about long haul COVID, NAD is used to really help with the mitochondrial As a result, it will help to longevity and also lengthening that telomere and help with the longevity for anybody. So this is very helpful for anyone who feel tired long term.
Next, we'll discuss what to expect after an IV. Most people feel more hydrated, clearer mentally, calmer, more energy, improved recovery, and better sleep. And that could be because of a sodium chloride from the bag, or because of magnesium or B vitamin added and other nutrient added as well. Sometimes benefits show up immediately, and sometimes over 12 to 24 hours. Normal side effects to watch out is mild bruising, temporary vein tenderness, lightheadedness if dehydrated beforehand. So we always want to make sure that the client is drink plenty of water. Rare but possible side effects: allergic reactions, especially to needles, alcohol pad, or any type of topical use. Electrolyte imbalance if not screened beforehand. Vein irritation requiring slower infusion. A good clinic monitors all of this. The big question is, should you get IV therapy? Here's the real question. Is IV therapy worth it for you? It depends. I know. IV therapy is a meaningful tool for people who are depleted, are in burned out, have absorption issues, need rapid recovery, have high stress and demand, have midlife hormonal shifts, making symptoms louder. Is not the right tool for people who want a quick fix, aren't addressing lifestyle foundations. Expect IVs to replace habits. That's the first thing. Use it as a support, not a substitute. Hear me on this. And often I always go with lifestyle of nutrition, what is organic, eating the food closer to the ground, and move your body, mental health to make your mind-body connection and knowing what your body is telling you. So if you're thinking about IV therapy, or if you're trying to rebuild your energy, your stress tolerance, or your hormone foundation, please don't start with advanced therapy. Start with the basics your body is begging for. I've created a free 7-day Health Jumpstart that resets your energy, improves your stress rhythm, and helps your hormones stabilize, all at home without overwhelm. It's very simple, it's evidence-based, and it's a foundation I recommend before adding IV support. Check it out on the description, link below.